Assalamualaikum warahmatullahi wabarakatuh. Good morning, honorable judges, and dear participant of the 3rd International Graduate Conference on Biomedical Pharmacology, Bioengineering, and Technology. My name is Adisti Fathana, and I am representing Muhammadiyah Yogyakarta University. It is my great honor and pleasure to present our research entitled Integrating Oral Health into Chronic Disease Management, Evidence from Underutilization of Dental Services in Indonesian Primary Care. Oral health is an essential part of overall human being. Poor oral health can negatively affect reducing an individual's quality of life. Particularly, it is very important for people living with chronic disease. The untreated oral infection may compromise the management of chronic disease through the well-established bidirectional relationship, meaning that oral infection can interfere with the effective management of chronic disease. The burden of chronic disease, particularly diabetes mellitus and hypertension, continues to rise in Indonesia. The special region of Yogyakarta has one of the highest prevalence of this condition in the country, with the M affecting 3.6% of individuals aged greater than and equal to 15 years, and hypertension affecting 13% of those aged greater than or equal to 18 years. To address the growing burden of chronic disease, the Indonesian government introduced the Chronic Disease Management Program, or PROANIS. This nationwide primary health care program focuses on improving disease control and reducing complications in patients with type 2 diabetes and hypertension. And to understand healthcare utilization, this study used Anderson behavior model. According to this model, healthcare utilization is influenced by three key factors, that is predisposing characteristic, enabling resources, and healthcare needs. Despite the nationwide implementation of PROANIS, most previous studies have focused on medical outcome while oral healthcare utilization has received considerably less attention. Therefore, this study analyzed dental service utilization among PROANIS participants by examining trends in dental visit, diagnosis, treatment, and referral over 2 years period. For the material and method, this is a retrospective descriptive study, used secondary data from the medical record of PROANIS participant at Firdaus 24-hour primary clinic, Yogyakarta. We included all participants with complete record between January 2022 until December 2023, and the variable analyzed included participant characteristic, dental visit, diagnosis, treatment procedure, and referral records. And for the statistical analysis, the utilization rate was calculated as the percentage of dental visit among all registered PROANIS participants each year. Research result of participant characteristic shows that most PROANIS participants who utilized dental services were older adult aged 55 years and above. And for the proportion of male and female participants were relatively similar, suggesting that age may have played a role more prominent than sex. Research results for dental service utilization among PROANIS participants remain persistently low, increasing only slightly from 0.12% in 2022 to 0.13% in 2023. This is concerning because patients with diabetes and hypertension have greater oral health needs, yet show low utilized dental service. Research result for dental diagnosis shows that the most common diagnosis was disease of the pulp and periapical tissue, suggesting that many patients sought dental care only after symptoms develop. And this is concerning because oral and chronic systemic disease influence each other to a bidirectional relationship. Consistent with the predominance of consultation and pharmacological management observed in this study, indicating that dental services were mainly used for symptom relief rather than definitive or preventive care. Research results for referral rates among PROANIS participants remain relatively low. However, this should not interpret as evidence of adequate problem-solving capacity by itself. Rather, it should be interpreted alongside the referral decision, may also depend on case severity, clinical judgment, available treatment option, and access to secondary care. And discussion for this study is individuals with chronic disease such as diabetes mellitus and hypertension have a bidirectional relationship with oral health. As a result, they have higher oral health care need and require a regular preventive dental care. But however, our finding shows that dental service utilization among Pro-List participants remain low. This is suggesting that many patients are not accessing preventive oral health care, and consequently, oral disease may go undetected until symptoms develop. This is leading to the late diagnosis and more advanced disease. This is reflected in our finding too, where disease of the pulp and periapical tissue were the most common diagnosed, and also consultation with pharmacological management was the most frequented treatment, indicating that care was mainly symptom-oriented rather than preventive. Although referral rates were also low, and this should be interpreted cautiously because referral decisions are influenced by multiple factors. And overall, for the problem solving, this finding highlight the need to better integrate oral health into the Pro-List program, so that oral health become a routine component of comprehensive chronic disease rather than being solved only after problem arise. This oral health integration, consistent with the World Health Organization that report about oral health, should emphasize of integration. And this integration should include closer collaboration between medical and dental professionals, routine oral health assessment, oral health promotion and oral health literacy, preventive dental care, and appropriate referral pathway. And together, these strategies can facilitate earlier detection of oral disease, reduce avoidable oral complication, increase the utilization of preventive dental service, and improve continuity of care. Ultimately, integrating oral health into chronic disease management can provide more comprehensive, person-centered care while improving both oral and systemic health outcomes. In conclusion, integrating oral health into chronic disease management within Pro-List is essential to achieving comprehensive, person-centered care and improving both oral and systemic health outcomes. Thank you for the attention and thank you for the opportunity that has given to me. Wassalamualaikum warahmatullahi wabarakatuh.